Good evening. Welcome to tonight's live webinar, Keeping Families Together, Pet Support at the Shelter During COVID-19 and Beyond. We want to thank our sponsor. This webinar tonight is sponsored by Pet Hub. A couple housekeeping items. There's a chat function if you all want to communicate or share thoughts. Use the chat function. There's also a Q&A function at the bottom of your screen. Feel free to submit questions throughout the webinar and there will be time to answer them at the end. I'm excited for tonight's webinar. We have three amazing speakers from Tucson, Arizona, and I'm going to let Kristen Hassan-Auerbach, the director of PACC Animal Care Center, introduce our other two speakers this evening. Thank you so much to the three of you for being here tonight.
Hi, everybody. My name is Kristen Hassan-Auerbach. I'm the director of PACC Animal Care Center in Tucson, Arizona. And here with me tonight are two of our leadership team members at PACC, Christina Snow, who heads up our Animal Protection and Field Services Unit, and Bennett Simonson, who heads up our Outreach and Community Partnerships at PACC. And we are also excited to be here with you tonight. We talk a lot about the programs at PACC, but we haven't had a big opportunity to get to share via webcast all of the outreach and community-based efforts that we're doing at PACC. And we think that they're really different than what's happening in a lot of places. So we want to welcome all of you. Please say hi in the chat so we know who's here. We're so excited that you're here, and we have about 400 people registered for this webinar. So folks that aren't here tonight will get to watch it later. We want to start out by telling you just a little bit about PACC. Hey, from Boise, Idaho, cool. And hi, San Marcos. So PACC is in the middle of the Sonoran Desert. It's one of the most diverse places in the US. It's absolutely beautiful. It's a lush desert, so it's very green. It also covers a whopping 9,000 square miles. So our county is about the size of New Hampshire. It's giant, and it's also the longest stretch of the US-Mexico border of any county. And it only has about 1 million people. So it's relatively small in population, huge in land size, and faces a number of challenges because the climate here is hot and dry. And in the summertime, the conditions outside are truly deadly for animals if they're in need of urgent care. And we also have arguably the 6th highest poverty rate in US cities. So there's a high rate of poverty, and that leads to challenges with people being able to properly care for their pets. Wow, there's so many people here. We're so excited. I see so many cities I recognize and so many that we don't. So I'm going to turn it over now to Bennett to tell us a little bit more about PACC and just to give you a quick overview of some of our programs. You're going to hear, we're going to basically tonight, the way it's going to work is that we're going to give you an overview. We're going to kind of run through everything, and then we're going to chat a little bit and then turn it over to you to answer all your questions, because tonight is really about you. And while we're really excited about what's happening at PACC, our goal tonight is to help you implement some of the same programs that have been so incredibly successful at PACC Animal Care Center. So the last thing I want to add is that our life-saving rate is a raw 92% of the 19,000 pets that we take in. So it's a lot of animals coming in from a relatively small population, and we save more than 9 out of 10 of those pets. So Bennett, take it away.
Thanks, Kristen. So PACC took in about 19,000 pets last year, and in our intakes, we identified 3 zip codes that are our target areas. These are areas that have higher levels of intake and fewer available resources. So we try to focus a lot of our reach into the community on these areas to have a bigger impact on the animals that come into the shelter. 2 of the main core parts of PACC's programs are our foster program, which served over 5,000 animals in 2019. It's a key part of our life saving and really allows us to expand our reach. And then another core part is our system of pet support programs. Various programs that I'm going to go into in a minute that help provide support to the community to keep their pets in the home. So one of the main parts is our pet support call center. This is where anybody who is considering surrendering a pet calls in, and we provide resources that they may need to mitigate that surrender. So acute medical costs, pet deposits, talking them through behavior issues, and just generally helping people navigate the system of programs that are available to them. We have our Pup in Boots program. One thing about Tucson is there is a large population of people experiencing homelessness. So the Pup in Boots program actually started with a volunteer who saw dogs walking around in 110-degree weather and wanted us to get booties on them to help protect their paws. The more we went out, the more we discovered the other needs that people experiencing homelessness with pets have, and we started providing for them. We go out to organizations already serving people experiencing homelessness and utilize the connections they have in that community to serve pet owners. We do targeted wellness events, vaccines, microchips, things like that to those people. We gave out over 10,000 pounds of pet food just to people experiencing homelessness in 2019.
Can I jump in really quick?
Mm-hmm.
So we also have our animal protection. So some of you might call it animal control. We call it animal protection. Our animal protection officers also help with this program. And before we started this program, people who were our most vulnerable residents would often run the other way, literally, when they saw an animal control officer. They would think they were going to get cited or in trouble or told that they weren't, a good enough pet owner. So since we started these programs, the opposite has happened. Our vulnerable residents, people experiencing homelessness, they see our animal control trucks and they come running up for help. And so we've totally changed our relationship with the community. Why does that matter? It's nice and all, but why it really matters is when there's a problem, our community trusts us. And so if they do actually see cruelty or neglect or animal abuse happening, the same people who would have been afraid to reach out now call us immediately. And that's thanks in large part to work of Snow and Bennett. Snow, do you have anything to add to that?
No, I think that, I think you summed it up really well. For me, I started when we were considered dog catchers, and it was embarrassing for me. So to be able to make such a huge change in such a short amount of time, and have people coming up to us and kids coming up to us, and it being, humanizing the badges, it just means a lot to me, and I'm super proud. And you said it well.
So one of the last parts of this program we have is our neighborhood pet support. This focuses on those zip codes that I had mentioned earlier. It's not only because we want to get into those zip codes to help mitigate some of the issues people face that lead to high intake, but also we're building up that relationship. We know that people there are certain areas where people engage less with the shelter. They probably have a more negative view of us. So we're trying to go out and establish ourselves as that pet resource where they can come and get the resources they need. They can come get the assistance and information they need rather than being the scary dog catchers. So our neighborhood pet support goes into those target communities and tries to have proactive contact with people and build up those relationships. We provide fencing assistance. We provide fencing supplies. There's door-to-door outreach to engage with the community proactively, and we attend community meetings and work with community organizations that are already serving that population. We do targeted wellness events. So we actually mapped out the areas where most of our cases of distemper and parvo come from, and then are doing wellness events in those areas to try to mitigate the risk of those diseases, try to get those animals vaccinated. In 2019, we served over 1,900 pets at 21 different events, some of them serving as many as 450 pets, and some small neighborhood events. All of our pet support programming is supported by grants and donations through our nonprofit partner, the Friends of Pima Animal Care Center. So we know—
Hold up, 1 minute. Okay, so whenever I attend presentations where people talk about themselves the whole time, I usually end up sitting there going, yeah, that's great for you. But what we want to emphasize too is that we don't have funding for this program. We don't have a huge operating budget. We are a municipal shelter in a resource challenged area. And so when we started these programs, we had to do them all without money. And the way that we've gotten funding to do them is almost entirely through grants and donations. What might surprise you to hear is that people love donating to these outreach programs. Bennett told you about the Pup and Boots program. And you know what, he didn't quite tell the whole story, because I told him he had to go really fast. But in the desert, when it's 120 degrees, dogs walking around, they literally will get burns. Have any of you seen the burns that dogs can get on the pads of their feet from walking around in hot pavement? That's a common phenomenon here. And so putting tennis shoes on all the dogs was a way to solve that without taking pets away from people who do live outdoors. And why that's been so meaningful is when you go around Tucson in the summer, now you see all the same dogs walking around, but now they have water bowls people have water bowls strapped to their backpacks. They have doggy water bottles, and all the dogs are wearing tennis shoes. So that program wasn't just a cool thing to do for the community. It literally prevented animals from being harmed, their feet hurt, and it kept them with their owners where they belong. So, okay, Bennett, sorry, back to you.
So we all know there have been lots of impacts of the pandemic on the community. People are having to social distance, which means it's more difficult for them to shelters, and a lot of them may not have transportation. Something that may not be immediately obvious is if somebody relies on their friends and neighbors for transportation during this time, they're not going to have that resource. They're not going to have a way to get to your shelter. So we need to figure out how to overcome some of these barriers. People are also facing a lack of services due to suspended programs. People who are sick and ill or unable to care for their pets, they may have to be in quarantine, or they may be hospitalized and not have somebody to take care of their pets while they're dealing with COVID. This is especially prevalent in people who are experiencing homelessness, because they may end up going into the hospital or somewhere else where pets aren't allowed, but there's no one who can keep their pet. We're obviously also facing high levels of unemployment and widespread loss of income, all of which means there are services that people need now more than ever. It's also having a huge impact on our shelters. We're having to change the way we interact with people for adoptions, intake, outreach, every aspect of what we do. We're having to have more PPE and take increased precautions for our APS officers and all of our staff to protect them. This leads to higher levels of stress for the staff's out sick, and a lot of you are probably thinking, how can we add in these extra programs to support the community when our staff is already dealing with all this other stuff? We want to talk to you about how to do this in a way that works for your staff, doesn't add stress, but does still provide that support the community needs, because there have been a suspension of other services and these increasing needs. So one of the big things we're doing at PACC is we're doing appointment-only services. People have to call and make an appointment to come in to adopt, to surrender, which we've always done appointments for that, but even more so now. It does a lot of things for the shelter. First off, reduces the number of people at any given moment. It increases feelings of security for our staff and for the public to know that we're limiting the number of people in the space and that we're doing all we can to keep them safe while they're here. We're doing adoption counseling over the phone, which allows us to spend more time going over the details of pets and can help guide people toward the right picks. And we're identifying RTOs through pictures, and we're bringing pets out to potential owners rather than having the owners go through the kennels. We've gotten fantastic feedback on this so far. The staff really appreciates being able to control the flow of people in the shelter. They don't feel like they're about to get overwhelmed with all of these people coming in. It gives us more time, and the public is really appreciating the increased customer service. We've suspended non-emergency surrenders, so friendly strays when they can be housed safely in their finder's home, and then owner surrenders for non-emergencies.
Can I jump in on that? There's been this, since COVID, we really decided we had to prevent animals coming in that didn't really need to be in the shelter. And a lot of that is because we have a need to reduce human-human contact for the safety of people. That doesn't though mean that we are not serving dogs that need us. And one of the sort of striking things to me was last month in April, which was our most restrictive intake, we still took in 633 animals, but typically in a month we take in closer to 1,600. And so we were actually able to keep more than half of the animals in the community and not have them come into PACC. And that's the goal. Sometimes you hear conversations that community services can simply shut down the shelter and they won't be needed anymore. And we don't, in a community like ours, that isn't possible. There are always going to be sick and injured animals, animals in immediate danger who need our help, strays wandering beside a busy road who may get hit by a car. All of those animals still need to come in, but animals that can be safely housed in the community have been. And it was funny to me. We have weekly Zoom meetings with our volunteers, and we asked our volunteers today, do you think we should maintain what we're doing now for the next few weeks to months, or do you think we should change and open up the doors and make it the way it was? And our volunteers unanimously said they think that in an abundance of caution, it's actually safer and better to keep doing it this way. And people really appreciate that for the first time that we're able to answer the phone when they call. They're not having to wait. They can get a more immediate response to us. So we're actually able to provide better service to people doing it this way.
And a key part of having to change the way we're doing intakes is providing more support to people on the front end about surrender and finding the owners for any strays they found. We're giving them information on the best ways to search for a new home. We're giving them guidance on when they're searching for a new home for their pet. And we're trying to give them guidance on how they can best search for that owner. We're not just saying we can't take it in. We're trying to provide the support they need to actually successfully find a good outcome for that pet. One service we are providing new to the community is an emergency wellness clinic. Our in-shelter clinic team is able to provide minor medical care and basic wellness to the public because of this pandemic. Generally, we don't provide service to owned animals, but we are in an extraordinary circumstance, and we know that there is an increased need in the community. So we're doing shots, minor medical conditions, getting medications, and helping people arrange for spay-neuter. That's happening at the shelter, and our pet support center makes the appointments for people who are considering surrender, and then hopefully we can address the issue and avoid the surrender. We're also taking referrals from social service agencies and human service partners who identify people who need assistance. And now I'm going to hand it over to Snow to talk a little bit about changes in our animal protection.
Thanks, Bennett. So we have, just to kind of play off of that last slide that y'all saw, our animal protection, I have, since I've started a year and a half ago, 2 years ago maybe, about a 98% turnover. And that was due to really the vision that I had for this department. I have never been a believer in punitive measures. I like to really get to the root of the problem and see how, how can we fix the problem? Because the problem isn't throwing, punitive measures at people that are already struggling. So something that our officers have done with that wellness clinic is work with our veterinarians to just give information, and instead of citing for something really minor for vet care, we're getting them into these wellness clinics, getting them the care they need, and then following up to see if that solved the problem. It's been a little challenging with this COVID pandemic. We all, I will throw myself under the bus and say I didn't really kind of believe that this was all going to hit us, and then it did, and it got really scary. So it was my goal to figure out how to provide these services to the community that they need, but keep my officers safe, because that they needed that, and I realized that they needed that. So something I was able to do through some pandemic grants is get them cell phones, alternative methods to communicate. So if we can FaceTime with somebody who's got an animal on bite quarantine, if we can have the communication outside of the door, we will do that. And it's really opened up different avenues that I think we can even use beyond this pandemic, hopefully, when this starts slowing down. we've, again, my officers are really my utmost concern. So I've made sure that I've provided all of the PPE. They don't go into homes unless they absolutely have to. And we all know, that there are needs that we do have to go in. We do still have safety concerns. We still have neglect concerns, and those, they're not necessarily ever going to go away. So I think it's really important to make sure that they feel safe. You've got to get them their N95s, you've got to get them their gowns, and you've got to not only get it for them, but explain how to use it and why we're using it. We implemented a little flyer throughout the shelter, and our officers kind of have their own version because, like Kristen said, we're this, you can probably see our dog truck there. We are pretty bright. You don't miss us. And now people come running because they think it's super cool and want to talk to us. So it kind of backfired with us a little bit because people were right up to our windows. So we've made alterations to how we kind of run our entire department. We have competitions in our field returns, and it's just kind of the way that I've had to engage my officers to let them understand that every animal they bring in kind of impacts the shelter and the way that we operate. I've purchased crates so that the animals that have to be in home quarantine can stay home. They don't have to come to the shelter. We've supplied backpacks with bowls and treats and soap and you name it, we're providing it. And we've also partnered with people in the county to hit those kind of the transient population that we have here. So you just kind of have to think outside the box, and I think the important part of that is having officers that really want to do that. And our team definitely does. So what we've done in the community was, as I stated, partner with outside organizations. We're working with a couple people in the county. We've come up with an entire program that will basically house, and this is through the pandemic emergency funding, house animals for 30 days so that the people can get off the streets and get, basically these people are high risk, so it's getting them out of that community and hopefully keeping them safe and healthy, and then we can provide that care for the vets or the pets. So our officers are transporting. We've come up with all of the forms for it, and I mean, it's been really successful and really rewarding for our officers. I constantly have them asking what they can do next and I mean, it's like full-on arguments on who gets to do the next really cool outreach event.
So what you see in front of you is our hoarding response team. And we're going to talk a little bit about this, but every community has their own challenges. And are we housing people's pets for free of cost for 30 days? Yeah, depending on the situation, we are. Right now, what we realized is that, so at our shelter, I wish we could walk you through right now, because we have 722 dog housing units, nearly 500 cat housing units. Since the beginning of COVID, we've changed how we house animals. So we have about 1,000 pets in foster and about anywhere from 100 to 200 on site any day, which means that we have ample kennel space. But we want to serve the public how they most need to be served right now. And so we realized there were certain situations in which it really was better to have animals here. So an owner who's experiencing homelessness, who gets COVID, may be put up in a hotel if they don't need to be hospitalized. But we wouldn't want that person walking around with their dog spreading COVID. It's a hotel dedicated to folks who may or may not have COVID, but we wouldn't want that person walking around with their dog. It's actually safer to have it at PACC. So now we're able to provide boarding. And what it does is it gives people reassurance. It lets them know their pets are safe. And otherwise, those pets would be coming into us as intake. They would be our custody, and we would have a whole nother issue on our hands. And so we've really focused, what our team said at the beginning of COVID is, this is going to create historic economic and medical challenges for our community. We know that what we're seeing now is unprecedented, if only in terms of job loss and the financial struggle people are having. And so we said at the beginning of COVID, what are we going to do to help people during this time? And I think our team's driven by this idea that those people we're serving are us. Any one of us 2 paychecks away from being someone that needs services. We're all really lucky to be employed as essential public servants right now, but we may not be. And so we imagine that every person who comes to us for help is us, and we treat them the way we want to be treated. And so by providing food distribution and housing, we're really trying to emphasize that we care deeply about pets and the people that they love, and that we're really here to serve the human-animal unit, not just the animal once it's taken away from the owner. So that's kind of the ethic that guides all of this work, and it's why we're piloting these own pet services. We never thought we could provide own services for own pets, but we got grants and donations that are letting us do that. And it's why we're now using those same kennels that would hold pack pets to board other people's animals, because it's the right thing to do right now.
It's also, I mean, it's so rewarding as somebody that has been in the field and seen how much people truly care. And it's really, it is really easy to get a bit jaded in this field at times, but it's so rewarding. And if I could share some of the pictures of the pets that we've brought in from some of these homeless individuals, I would, but I can't. But just trust me, they're adorable and so rewarding. And I think if you engage your team, you would be surprised how many people really want to be involved in this.
So another area where we are making shifts is in RTOs. We want to reduce the number of trips that somebody has to make to PACC. We want to reduce the number of exposures whenever possible. And we are dealing with people who are quarantined or otherwise housebound. Just because you are on lockdown for 2 weeks doesn't mean your dog can't get out and end up at the shelter. What is somebody going to do if they are COVID positive or COVID exposed and their animal ends up at the shelter? So we're trying to help people transport their animals back home. A key part of this for us is our Lost and Found team. They help reunite owners with their pets by helping identify their pet when they come into the shelter. And if we identify that pet, we can transport it back to the owner and not have them make an unnecessary trip to the shelter and not have people get exposed unnecessarily. This concept can also work for adopted animals. If somebody comes in and is interested in adopting an animal that isn't quite ready to go home, why would we make them come back to the shelter and expose everybody if not necessary, if that wasn't completely necessary? If you're considering something like this, though, you do need to make sure to consult your leadership team and your legal team, because transport can be tricky and you want to make sure that all your T's are crossed and I's are dotted before you get anything started.
All right, Bennett, are you, wait, go back.
You want me to tell about Brownie?
Well, I want to tell the beginning of the Brownie story, and then I'm going to hand it off to you. So we hear and tell a million cool stories, but this is probably the story of the year for us, because I learned about Brownie, who you see here, when his paperwork came to my desk to sign off for behavioral euthanasia. He was a dog with extreme stranger danger, and his owner had brought him in because the landlord said the dog's got to go, not because of aggression, but because he was barking at the fence and driving the landlord crazy. And so the landlord said, dog's got to go. He comes in, and Brownie's owner surrendered him. And so I signed off for euthanasia, actually, and our deputy director said to me, you know, he lived in a home with a small dog, he's lived around kids, and he doesn't have any behavior history in the home. And it sounds like the owner had to give him up because of housing. Could we try to find the owner pet-friendly housing? And so that's where Bennett and Snow and our other folks who do these things, who help people like Vlad, stepped in. So Bennett, what happened after that?
We were able to get Vlad set up with some fencing assistance. So what you can't see very well in the picture is we provided him with fencing materials to reinforce his fence and provided him with a kennel run to keep Brownie in when Vlad was not there. We spoke to the landlord, got Brownie evaluated behaviorally, had a lot of work with Vlad, and got the landlord to agree to let Brownie come back home. And then this is picture is us returning Brownie back home. As you can see, he was very happy to be with Vlad. And that picture of him laying was that night. He immediately ran into the house and jumped up on Vlad's bed when we got him home. And we were able to keep this animal in the home by overcoming simple barriers like transportation and getting Brownie back home and the fencing issue. It was quick and much cheaper for us to provide a $50 roll of fencing, or through Friends of Pima Animal Care Center provide a $50 roll of fencing, than to house Brownie indefinitely or have to euthanize him for something that ultimately wasn't necessary.
Well, and the thing about Brownie was when we called his owner, what was significant to us is that we said, if we had a way for you to keep this dog, would you? And Vlad couldn't afford a different place to live. It was like one of those cases that seemed hopeless. The total amount he could afford was $400 a month. And as you can imagine, that's not very much to try to find a new place to live. And so what the team did is they went back to the landlord and they talked with him, and it took us about a month and a half to make all this happen. But the average length of stay for so many dogs in shelters is so much longer than that. And what was meaningful to us, and why I think this is the story of the year, is almost every single day during that month and a half, Vlad came to see Brownie. He came to visit him, and he spent time with him. He learned how to train him. And they were able to maintain that bond the whole time, even though Brownie couldn't be with them. And now he's home safe and sound. And I think to our team, it was a lesson that, like, even when a situation seems impossible, maybe we just have to be trying harder. Maybe we're just not trying hard enough and not believing it's possible. And if we do, we could really change everything for dogs like Brownie, who wouldn't have a second chance at life.
And when we're dealing with these life and death decisions and possibly having to euthanize an animal, we do want to go to extraordinary measures to help get them back home. We want to save their life. And that's especially true now during COVID. There's so much going on. People are going to be facing so many barriers and struggling in so many different ways. We want to do everything we can to help preserve those families, keep those pets alive, and serve the community in whatever way they need. The last thing we're doing at the shelter right now that is due to COVID is supply distribution. So we've already been handing out supplies historically through our Pup and Boots program. APS has been handing them out. Our neighborhood resources handing them out. Now that we have to suspend some of that, we were struggling with how do we continue to support the community? People have come to rely on us, and how do we not leave them hanging out to dry during this time of increased need? So we've been trying to provide supplies to the community. Like Snow mentioned, we'll provide crates, we're providing food, training supplies, almost anything somebody needs to keep the pet in their home, and not only keep it in their home, but keep it happy, healthy, and with them, we are trying to provide. It's for intake diversion purposes for people who are considering surrendering, but also just overall community support, because we know that people are struggling right now. We're doing a drive-through supply distribution so that people don't have to come in close contact with each other. And we're doing limited or no contact supply drop-offs. There's some staff who can't do the normal jobs because of the changes in programming we've had to do. And there are volunteers who want to help out. So people are willing to drive stuff to homes and leave it outside. There's the added benefit of helping people who are housebound, not just that we're providing it. Like, somebody who's positive for COVID may not be able to go get dog food. And what are they going to do? We can help solve that issue for them.
Can I add to that point? Use your officers if you can. We've been using my team to deliver supplies to foster homes that don't want to come out of their home, but they've got, you know, some of our dogs or cats. Use the resources you have, and let me tell you, I received a few emails personally from people that were just shocked to see somebody in a uniform and badge just dropping off supplies and helping them.
And the end goal for all of this is to help give people the resources they need for their pets, help keep those pets in a condition, a good condition, help keep them healthy, and make sure that pet ownership in the community is able to flourish during this hard time.
Okay, so one of the things that we want to make sure you remember when you leave here, we have no money, we have no supplies to give away. We can't give away our own food. We can't give away our own supplies. This is all donation and grant funded. So we have amazing partners like greatergood.org, but the way that we got Greater Good wasn't really anything special other than calling them and saying, we really want to help the community and we can't. And so for those of you who want to start these programs, but that amount of food looks impossible, it really starts with the day-to-day engagement of your staff and volunteers with the community. So during COVID, I had to get an eye exam because I had no contacts, and I was sitting waiting outside and social distancing, and this person started asking me, found out I worked at PACC, and said, and I was telling him about our free food distribution, and he said, but do you give people food? And I said, yeah. And he goes, well, what if I bring you bags of dog food? Are you just going to give them one big bag? And I explained how one bag of dog food can go to feed 15 pets in a week. And he showed up the next day at the shelter, and he had brought about 6 bags of food for cats and dogs. And he had gone to the store, and that's how people feel about these programs. And if we are missing something fundamental in this movement, it's that we have got to start telling the community what we need and telling them how they can help. We are not doing that nearly enough. And what Snow and Bennett have done so well is we are all ambassadors for PACC. We're all out, the officers are out handing out,
Sorry, I'm gonna continue and then we'll let Kristen chime back in. So I bet a lot of you are sitting there thinking, this all sounds fantastic, but how do we start? We're already all strapped for budgets, we're strapped for time and staff resources. We don't have supplies. How do we make this work? Well, it doesn't have to look for you like it looks for us. The guidelines and rules about your program should be determined by what services, what resources you have available. So what supplies you have available to you, what staff resources or volunteer resources you have available. If you're limited, maybe you only take referrals from trusted agencies. That way you don't have to do any legwork on the front to confirm that you're helping the people who are most in need. You're letting human service organizations tell you who they feel is most in need. Maybe you have a limit on the number of supplies somebody can get. Maybe it's only available to people who are considering surrender. Set your guidelines based on what you have available and make it work for your organization. The most important part of setting those guidelines, though, is being very clear with the public about what they can expect and what services we're providing. So when we're saying we're giving out food, we're making it very clear that they're not going to come and get a 50-pound bag of pedigree and walk away with that and be good for 2 months. We're supplementing food. We're telling people what limits there are, and we're letting them know to expect long waits when they come. It's not going to be quick, and they're not going to be the only people there, but we're going to do everything we can to make it go quickly and to keep them safe while they're there.
I have this Amazon addiction that has started during COVID. Well, it didn't really, but it's gotten worse. So I apologize. That was the exciting event of the day. Package delivery. So yeah, right. So we try to manage expectations really clearly with the public. And I think the need in our community is great. Some of you probably live in places where you're going to target services more. Bennett, when we get done with the PowerPoint, I want to be sure to touch on the mapping that you've done and why that's mattered, because for some of you, you're dealing with very targeted areas where resources are needed. What we're talking about today is so much about what's happening in the shelter or through animal protection services. But during non-COVID times, our outreach team is also out at 3 to 4 different homeless outreach events every week, handing out food and supplies. So Right now, we're really focused on these core services, but typically we are out trying to hit the hot spots of people who really need food.
And like Kristen was saying, some people are going to have to target their work very into a small area because your resources are limited and you're trying to have a stronger impact on areas that you know have higher intake or that you know are greater or more in need. So the first thing you need to do for your program when you're trying to identify how I can help, who I can help and who I can't, is to identify the goal for the program. That may seem really straightforward, that the goal for the program is to assist people, but you have to be more specific than that. Are you just assisting people who are struggling right now because of COVID issues? Are you trying to provide assistance to a certain area? Are you trying to provide assistance to prevent surrender? Not, those things are similar, but they are not exactly the same. And you need to be very clear on what that end goal is so you can create the correct measurements and create the correct guidelines. For example, don't require spay and neuter licensing if you're just trying to assist people who are struggling in this time. It's our first instinct, most animal shelters, to require spay neuter or something like that to say, okay, this person is making an effort on their end. But what that does is make the program about spay neuter, because if I lose my job due to COVID, but my animal's not altered, I don't get any help. There's no way to get him altered now, and I'm out of luck because the spay neuter requirement is there. And then you're not meeting your goal of helping me because I'm struggling for COVID. Also, it's very important to keep in mind while you're setting up these guidelines that there are roughly 2 different types of poverty. There's conditional poverty, which is what we're seeing an increase of now, which means something has happened to that person to put them into a situation where they're facing poverty. They may not have been in that situation before, so they probably had access to resources. They've probably gotten more for their pet. They know about the shelter. They know where they can go for resources. Systemic poverty is people who have been in poverty for all or most of their lives and will likely spend the rest of their life in poverty. Those communities tend to be the ones without access to resources. They don't know to come to the shelter, and they tend to be the ones that are more afraid to come to us in the first place. You need to be very aware of those differences because the community is not all equal, and you need to address concerns of people facing conditional poverty as well as systemic poverty. If you're working with other organizations, especially human service organizations, utilize their assessment practices. If we have somebody calling us from one of the organizations we work with to help people experiencing homelessness, we don't then go through and confirm that that person is homeless. That other organization has identified them as a need, and we're going to trust them to make good referrals to us. We just have to be very clear about what our limitations are when talking to those other organizations. So like Kristen has been saying, when you're building these, they can be done with minimal staff and resources. It's a matter of scaling the program to whatever resources you have available. We're able to hand out as much food as you saw because we have 24 volunteers who are willing to come in, and we have a staff member who was doing outreach to people experiencing homelessness who's now able to focus on this. Just make sure to be very clear with your expectations to the community so they don't think that you're going to be providing more than you're able to, and communicate freely. People are very gracious when you say, this food came and donated. We don't know how much we're going to have, but we're going to provide it while we can. We have to limit it because we have a limited amount. People are understanding and they want you to be able to help as many people as possible. Don't be afraid to utilize volunteers. Make sure to create clear processes and expectations for them. And realize that you have a lot of volunteers with skill sets that are already applicable to this. You probably have volunteers who are nurses, social workers, educators, public health officials. People know what they're doing dealing with the public. Give the volunteers the room to use those skill sets. Do you want to add something, Kristen?
Yeah, so one thing that I want to point out, Bennett, are we almost through? Do we have more slides?
One more.
Well, before we get to the final slide, the reason that you have the director, the chief of animal control, and the head of outreach and pet support all together is that we're interchangeable. So we could work, step into the other person's shoes any day, and that really matters. What we see a lot in organizations is that there's silos, and that while one part of the organization is really supportive of these programs, if another isn't, it causes a lot of problems. And I would say if we talked about challenges in our organization, it was initially we had to let go of the judgment, because even if it was one department or one person in a department, it was really messing everything up. And in fact, we were just talking today in our organization, we had an employee who anytime someone was getting support through our pet support center, or oftentimes they were actually putting them on a do not adopt list. That's incredibly problematic if you're trying to provide support programs. And so a lot of the key to this is communicating widely in the organization, having conversations among staff and volunteers, and then setting some basic expectations up for how we treat the public. Because doing this work, most of what we see are these like beautiful, happy relationships, but we also see people that struggle to feed themselves and maybe can't afford flea and tick treatment, or maybe their pet has gone a day without eating. And so some of that can be a little bit hard learning curve. So the communication among the team is really important, and kind of talking about what happens if we don't provide these services. Then people we just don't know there's a problem. And for us, we'd rather always know that people need help so that we can help them.
We could do a whole nother presentation on building trust within the community and why that's so important. But it is essential to have your whole organization on board, because one bad judgmental interaction can make somebody think that you are still old school animal control that's just going to come take their pet from them. And we don't want people to be afraid of coming to the shelter. So last thing, and I'm a bit of a data geek, so this is one of the things I'm most interested about, is it's very important to keep track of the services and programs you're providing to the community. Keep track of who you're helping, keep track of what they're receiving, keep track of as much information as you can. This is beneficial in a lot of ways. It helps ensure even distribution of the supplies. So if we had 700 bags of food and we were planning on handing them out for 6 weeks, but we handed out half in the first week, we need to know that so we can adjust expectations or adjust our program. It's also really important just to keep data and statistics. Let's say you're looking for a grant, use donated food for a month to hand out, keep that data, and then go to a place like greatergood.org and say, this is who we're helping and we need to be able to do more of it. Keeping data, keeping track of it helps you paint a picture of how your community is being impacted by your shelter and helps make the case that you need it. It's also going to help you better plan for the future. You have to do things like mapping, like we did for the wellness events, figuring out where parvo and distemper were coming from. We can target that resource to impact the things that are affecting the shelter the most. For snow, we know we have to go to certain zip codes to provide fencing assistance because there's a higher level of strays running around there. Keeping track of as much data as you can allows you to be way more effective and have a much longer lasting impact into the community.
So we have about 10 minutes left, and we want to be, I think we can off the screen share, Bennett.
Yeah.
Thank you, Pet Hub. Pet Hub is sponsoring this webinar, and we really appreciate it. It's so amazing to have the support of all these organizations. So thank you, Pet Hub, for sponsoring this webinar, and thanks for all that you do. We are gonna now talk, we wanna answer your questions. So one of the things that, and can we turn off the screen share so we can just see us, please? One of the things that we want you to really think about when you leave is if you want these programs to be effective, you just have to start trying them. We've been doing this now for 2.5 years, and we thought about overloading with data because boy, do we have it. We have GIS maps of just about everything you can imagine. We can show you where there are pet resource deserts. There are places where there's no access to veterinarians or pet food for sale. But we really wanted to focus on talking about the programs tonight and tell you that all of these started with no additional staffing, no additional resources, and we just started them as pilots. And if you do anything, it's leave here tonight and just go start something tomorrow. Call up your grant funding organizations, call up your community partners, your local donors, and say, we want to try this. Can you give us a little seed money to make it happen? Volunteers, we want to try this. Can you help? And then get the right people in the room. We can't emphasize enough that it is not, the people that are involved need to be people that are supportive and on board. PACC staff in the last 3 years really, the turnover in the organization has largely happened because people just weren't on board with the mission. And the mission is ever shifting. We do think of ourselves as providing animal social services to the community, and the people that we're all on the same team when it comes to that. And so just by the numbers, if you want to know how this can impact your org, last year we kept out more than 2,500 animals from the shelter just through the pet support call center. Pre-COVID, pre-drama, our normal pet support programs were keeping 2,500 pets in their homes and out of the shelter. This year, that number is going to be closer to 5,000 to 6,000 animals kept out. And if you're a person that, as a municipal director, I have to think about the bottom line and money, and there's cost savings in that. There's increased safety in the shelter from reduced number of dogs in a tight condition means less disease, less bites. So all of those things matter to me as a director, and we just, our whole philosophy is try it and see if it works. And out of everything we try, probably 4 out of 5 work great. Snow, somebody said in ballpark estimate of where funding comes from. I would say 30% grants, 35% grants, 50% local donors, and 15% operational funding. Snow, what else do you have? Because you're this animal protection director who is really trying to usher in a new way of providing field services. We have just a couple of minutes left, but what do you want the main takeaway for people on this webcast? We have over 100 people here today with 400 who are going to watch later. What do you want people to know?
I mean, I think the biggest thing for me is don't be afraid to set your standards, have your mission, and accept nothing less. You know, I have learned a lot since becoming a manager, and like I had said, it was a different world when I started, 2 years ago. We had 1,200 open calls, and now we've got, 180, I think, today. So I think that engage your team, hire people that want the same thing, that have the same mission, and accept nothing less. And don't be afraid to fail, because you will.
Bennett, how about you? You came from Pets for Life in North Carolina, and you've been doing these kind of programs for a long time, and you've also met a ton of resistance and had to overcome it. What do you want? You have a lot of leadership, but you also have, in this call, and you also have a lot of boots on the ground staff here who just want to make these programs work. What would you say to people who are interested in starting some of these but might be hesitant?
I think the most important thing to remember is people love their pets. We may not always see it. We do see the worst situations. It's really easy to become jaded, but people love their pets and they want to do everything they can to care for them. Sometimes they need some support, either because they don't have access to the resources or they just don't have the same information as you do. People don't get born knowing all about spay neuter. They don't get born knowing how. And sometimes people need a little help from us. It's just important to not let yourself get bogged down by the bad things you see and become jaded against pet owners. And it's important to keep thinking outside the box, because you're going to encounter people with barriers that you may never have thought of before. And like in a situation with Vlad and Brownie, sometimes you have to go above and beyond and try something brand new just to see how it works.
And it would have been really easy, and I think something that a lot of shelters probably would have done was judge that owner for giving them up, and that I'm really proud that PACC doesn't have that judgmental way.
We mentioned a lot about judging people because it has been our biggest barrier. Luckily, our community gets it, and I think We try to remember that there are all kinds of suffering in this world. And I know I've worked in big US cities where people get a shelter dog and they lock it in a crate for 18 hours and it lives a life in total isolation from other animals and mostly from other people. And that's one kind of suffering that happens for animals, and that wherever people struggle in the world, animals are going to struggle too. And we know that we see a lot of struggling pets and people, but I think all of us have been really convinced that this way of doing business, putting our judgment aside and going to those people who really are the people that struggle to buy food and maybe live outside, going to those people and offering help is a way to show that we care for every pet in our community. Shelters for too long have said, oh, not the pets in our shelter, they're not going to go to these homes, and the pets in our shelter are going to get this, completely forgetting that they're leaving behind all the animals in their community who would love to receive the help and support of the shelter. And so we really see ourselves as a municipal animal services agency as caring about every pet in the shelter, whether it's rehomed on Craigslist or it's owned by somebody who lives outdoors, or it's coming into our shelter because its pet owner can't afford care and we're going to provide that. All those pets are our pets. They're all our community's pets, and we're here to help them. And I think I can't tell you a downside to that after all the years of doing this. We've seen only just an amazing growing community of support for these programs. We have countless volunteers, donors, community members who are so excited to be part of these. We don't see a downside, and we hope that you will be really brave in this unprecedented time and try some of these programs, try and engage in your communities in ways that you're like, there's no way this is going to work. Try it, because you will be so surprised that just by offering a helping hand or asking for help, you're going to be amazed at what your community is going to get back to you and what that's going to mean for the pets. So thank you all for being here with us tonight. It's really an honor to get to talk to so many of you, so many folks we know, and many we don't, and we're all here to help. So we'll post our email addresses again. Bennett and Snow, can you post those one more time at the bottom? Reach out to us for anything that you need, and please follow the American Pets Alive Shelter and Rescue support page. Follow Pima Animal Care Center. We post about this stuff all the time, and follow me on Facebook. All I do is post about this stuff. So we're talking about it all the time. We're so excited, and anything we do, you can have it. You steal our ideas, take them, use them, and go do amazing things in your community, and we'll do the same. So thanks everybody, and have a wonderful night. We will see you soon.
Thanks, everyone. I realize we didn't get to some of your questions, so we're going to make sure that we get those questions over to the panelists. Have a wonderful night, and thanks again to Pet Hub.